So this afternoon, we begin, as usual, with the chairman of the Presidential Task Force, SGF, sir.
Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Monday, 11th May 2020. Yesterday, Sunday, 10th May 2020, marked the end of the first week in the eased restriction phase. I wish to remind you that we are still in phase one of the three-pronged fortnightly strategy. The completion of the first week has provided the PTF COVID-19 an opportunity for a mid-phase review of the impact of the guidelines put in place to drive our national response. I'm also sure that Nigerians have equally focused on the pandemic and have done their assessment of progress made, especially as it relates to compliance. One gratifying outcome of the assessment we have all undertaken as stakeholders is our convergence of thought on the level of compliance with the guidelines and how our individual and collective response could improve and or jeopardize our ability to contain the coronavirus. During the first week, the country generally witnessed increased number of positive cases. This is attributable to our expanded capacity for testing with the opening up of more testing centers and laboratories. As of today, there are 21 laboratories nationwide, including private laboratories, and we continue to engage with more private laboratories on stream. Similarly, we wish to confirm that states have been encouraged strongly to set up isolation centers, wards, including ICU, with a minimum of 300 beds each. This will help accommodate levels 1 and 2 cases. However, with the increase in numbers, we are beginning to experience some elements of shortages of bed spaces in isolation centers, especially in the high burden areas. We are conscious of the need to take care of different categories of persons, e.g. people living with disabilities, terminal conditions, and other underlying factors, stroke comorbidities. We have also been able to complete the evacuation of 2 batches of Nigerians from the United Arab Emirates and the United States of America, along with another batch from the United Kingdom. We would continue working with our missions overseas and other relevant partners to ensure the evacuation of others with clearly defined rules of engagement. The Presidential Task Force has continued to review the relevant policy and protocols so that our actions and decisions are most effective and the nation can properly take COVID-19 positive cases out of circulation to avoid the spread or continuous spread of the virus. We have recognized a significant role for community ownership, guidance, acceptance, and implementation, and the Presidential Task Force will introduce appropriate inclusive policies in the coming weeks. You will be apprised of developments on this in due course. As part of efforts to support the states in the establishment of isolation and treatment centers. I wish to remind our state governors that the Catholic Bishops' Conference has offered and volunteered all the 425 hospitals and clinics that belong to the Catholic mission nationwide for adaptation and use as isolation centers. Governors in the various states are encouraged to please approach Catholic archbishops and bishops in their states to access these facilities. As a further cost-effective measure, I also wished to remind some national authorities that the Nigerian Institute of Architects have pledged the pro bono services of their members to modify, design, and supervise all COVID-19 related projects nationwide. Again, we urge that this offer be taken up speedily. The Presidential Task Force has also continued to receive, rather sadly, reports about challenges facing the frontline health workers. They have received threats to lives, experienced detention by patients, they are actually nursing to health, and suffered other forms of harassment. Let me underscore the fact that these frontline workers constantly put their lives on the line to make sure persons infected are provided with the best care possible to enable them become healthy citizens again. It is therefore inhuman and unacceptable that patients engage in acts of locking them up and making demands that these frontline officers, most of the time, do not have the capacity to address. The Presidential Task Force COVID-19 views such behavior as reprehensible and should be deprecated. We call on all state governments to take this up appropriately. On the overall, the Presidential Task Force is identifying and assessing all low to medium and high burden areas with a view to assessing and modifying our strategy. This will involve drilling down from all tiers of government to community level. This mention serves as a notice to traditional and religious and community leaders to brace up for deeper involvement as we develop the protocols to strengthen community ownership in the national response. While we continue to work on all options, the Presidential Task Force wishes to repeat the dangers inherent in the lack of compliance with guidelines issued. We must always remind Nigerians that Mr. President took a painful and difficult decision to ease the restrictions by approving revised measures that will maintain a balance between the safety of Nigerians and giving them the opportunity for some level of economic activities that will sustain their means of livelihood, especially the poor and vulnerable who depend on daily means of subsistence. The eased restrictions must therefore not become an excuse for us to lead the lives we were used to pre-COVID-19 days. I wish to reiterate that the world today has completely changed from what we used to know. And if we want to continue living the old ways, the costs would be enormous. Contracting COVID-19 is not a death sentence, but disregarding the guidelines for its avoidance, as guided by experts, is a costly self-voyage. Unfortunately, such choice cannot be made by individuals, but the collective. And we are all resolute in stamping this scourge out of Nigeria. Tomorrow, we hope to commission the this-day dorm treatment and isolation facility. It will add a total of 270 beds to our capacity in Abuja. This is a private sector-driven initiative, and we commend the efforts of this day and its proprietor, the NMPC, Sahara Energy Group, CCECC, and all the partners involved in this enterprise. Finally, I wish to underscore our appeal to Nigerians to please continue to comply with the guidelines. You must take personal responsibility for actions. I now yield the podium to the Honorable Minister of Health to update you on new developments. Thereafter, the Director General, Nigeria Center for Disease Control, would have the floor, followed by the National Coordinator of the Presidential Task Force. I thank you for listening.
The Secretary of the Government of the Federation, Honorable Ministers here present, Directors, Director General, ladies and gentlemen. As at the end of yesterday, Nigeria has ramped up testing by 1,127 to a total of 27,078 tests performed, which yielded 4,399 cases in 35 states, with a gender ratio of 70 to 30% for men and women. 778 persons have been discharged home happily, and we have sadly recorded 143 fatalities, a case fatality ratio of 3%. The breakdown is as follows: Lagos 81, Jigawa 35, Borno 26, Kano 26, Bauchi 20, FCT 13, Edo 12, Sokoto 10, Zamfara 7, Kwara 7, Kebbi 4, Gombe 2, Taraba 2, Ekiti 2, Ogun 2, Osun and Bayelsa 1 each. Kogi and Cross River states have not reported any cases, but we are working with the state authorities to be able to visit and validate the situation. A team from the Federal Ministry of Health, made up of experts in various specialties, including the NCDC, is on standby to proceed to Calabar, as we have discussed with His Excellency Governor Ayade, as soon as possible when arrangements have been concluded. They will take with them resources needed to support the state. Senior management of the Federal Ministry of Health and clinical case managers in our hospitals this morning participated in a multinational teleconference with Chinese medical and academic experts in Beijing, where much insight was gained into the treatment strategy of China, and also other matters of common interest were discussed. The learnings from this intervention are valuable in re-examining our methods. It is important that our response to COVID-19 be a concerted national collaborative drive to stand a better chance of being effective. This requisite synergy cuts across the tiers of government, levels of care, and builds on partnerships to get it right for our country. It must be sustained and extended with room for interstate collaboration. So far, our efforts are yielding results, as shown in states where panic and fright were initially rife, but are now subsumed. I salute all our healthcare workers at the front line, who are our human resources, trainers, hands-on practitioners alike, who make care possible and are the most important element of our response. Your contributions are recognized, and we take up our hats to your service. The ministerial task team deployed to Kano State to assist in the containment effort and help to support the state government providing direction in managing COVID-19 situation has made significant gains. Together with the line directors from the Federal Ministry of Health and the IROA team, they have achieved several milestones, including enhancing community confidence, continuous training and capacity building to increase the pool of trained healthcare workers, doctors, nurses, hygienists, food handlers, etc. More than 100 ambulance drivers and patient handlers have been trained who have since been rendering service. The surveillance and epidemiology pillar organized a training session for state workers who have commenced field work. And the investigation into unexplained deaths in the state is yet to be completed and submit a report. The task team, led by one of our permanent secretaries, and 3 experts, including infectious disease specialists, visited Katsina State for situation analysis and were able to offer support. A detailed report is awaited from Dr. Guazo and is expected to provide a roadmap to addressing the challenges in line with our response pillars. Contingent of the Federal Ministry of Health team in Kano will also visit Bauchi State on a fact-finding mission and engage the government to map out their needs. A team will also visit Sokoto at the invitation of state authorities on a similar mission. With our entry into community transmission phase, there is an increased role for the National Primary Healthcare Development Agency, who shall now play a stronger role in the health sector response architecture. This will include activities from case finding to case management of asymptomatic or mildly symptomatic cases. The DSDOME Treatment Center, as the SGF has said, is a project of the Coalition Against COVID-19 and is complete, ready for commissioning. The Honorable Minister of FCT will participate in the event. The center is fully self-contained. It comes with its own PCR laboratory and a fully equipped ICU unit and an incinerator to destroy medical waste. Over 250-bed facility adds a tremendous boost to the capacity in the Federal Medical Center. Federal government continues to work with World Health Organization on the treatment trial called Solidarity, with the following states participating: Lagos, FCT, Ogun, Kaduna, Sokoto, and Kano. As restrictions are eased, I urge citizens to adhere to public health advisories on infection prevention and control. These include mandatory use of cloth masks outside of your homes and physical distancing. With regard to the use and maintenance of masks, it is important to emphasize that the mask must cover your mouth and your nose. During face-to-face conversation, your mask should cover your mouth and nose and should not be under your chin, lest the purpose is defeated. Cloth masks must be washed with soap and water daily and sun-dried. The usual advisory that I give on personal hygiene and respiratory hygiene is hereby repeated, especially with regard to those who have a cough, sneezing, and to use hand sanitizers. Thank you for your attention.
Chairman of the Presidential Task Force, Honorable Ministers of Health, Honorable Ministers, ladies and gentlemen of the press. My briefing today will be fairly short. We spent the weekend doing a review of the work that we're doing. Throughout this response, 3 months now, we've got to keep the wheels rolling, a supply chain going, IPC materials being delivered across the country, the labs working, supply chain to the lab, out of the lab. Now we have 23 labs across the network that have to be kept going. The surveillance architecture, the surveillance systems have to keep working. No matter whether it's Saturday, Sunday, these things have to work. So sometimes you take a break and review all the work that you're doing, plug some gaps, identify loopholes, and try and improve the system. So that's what we did throughout Saturday and Sunday, just to make sure we identify gaps, identify opportunities to improve, and we'll keep doing that throughout the outbreak. Like the Honorable Minister said, this is a new phase. We have to accept that there's community transmission happening, especially in Lagos and in Kano, and definitely in a few other cities in northern Nigeria, as well as in FCT. So in those areas, we'll have to adapt our response to meet, to face the realities that we're facing. This is a virus that is very easily transmissible, irrespective of the hard work that is being done across the country. So as it spreads to other cities, we adapt and change our response in order to manage that. We keep pushing in states that are not yet collecting enough samples to do a bit more. Do not rest on your oars. If you are not testing enough, you cannot know if the disease is circulating in your state. This is advice to those that want to take it. Eventually, none of us can manage this. This is a virus that we have to stay on top of. We see what is happening across the world. We see transmission happening in countries with a lot more advanced public health infrastructure than ours. So our responsibility to every Nigerian is to keep doing our best in prevention, in detection, and in care. So right now, we are pushing very hard. Every day, we keep pushing on prevention and asking Nigerians to take responsibility. We keep pushing to improve detection, i.e. improve our laboratory capacity, and like you can see from the results, we're improving every day. And now we keep changing and improving our care capacity. How do we provide increasing such large numbers of people the care that they need, both for themselves, but also to prevent transmission in their communities. So none of this is an exact science. Everybody in the world is learning. We are learning too, adapting every day. And as we learn, we adapt, we change, depending on the circumstances, not only of the virus, but in the circumstance in which it's circulating. So that's what we did throughout this weekend, looking at the response and finding ways to improve it. One way we're going to improve it are new guidelines of integrating private sector labs into the testing, into the laboratory architecture. So we've now come up with guidelines for this. So any private sector lab that wants to join the COVID testing can go pick up this guidelines that we're going to publish on our website tonight, look through it, define what they need to do to be able to join the network, and we will support them through that process. This is one bit of what the changes that we continue to make every day to improve the response. So that's where I'll pause for today, and look forward to your questions. Thank you very much.
The Chairman of the Presidential Task Force, members of the PTF, ladies and gentlemen of the press, good evening. First of all, I would like to talk about the socio-economic impact that the COVID-19 has had globally, and say that the PTF will continue to prioritize those human and economic needs of our people based on global guidelines on the pandemic emergency response. In particular, we will continue to ensure the protection of health services and systems in collaboration with ministries, departments, and agencies. We'll continue to ensure the protection, social protection and provision of basic services, including protection of jobs, both within the formal and informal sector, as well as encouraging multilateral collaborations with the public and private sector. It's important that we encourage social cohesion and community resilience in these challenging times when it comes to controlling the spread of the virus. From the surveillance viewpoint, the PTF continues to monitor cases in the northeast and the northwest part of the country. We are also investigating spikes that we've noticed, particularly hotspots in other parts of the country. I must emphasize the need for state governments to please continue to identify spaces for isolation of persons diagnosed positive with COVID. It's particularly important that we start considering unusual situations, environments such as schools, academic institutions, and even abandoned buildings, because we definitely need to build our isolation capacity. You may recall that the PTF provided guidance on ensuring that at least 300 beds are made available across all states for isolating people with COVID. And we're still concerned that a lot of states are yet to reach that number. In terms of public sensitization, and just to encourage the public to continue to personally monitor yourself for symptoms of COVID, especially now that we have community transmission. And just to remind you, this includes fever, cough, shortness of breath, headache, loss of smell, taste, and sore throat. Increasingly, we're going to be having a lot of persons with mild or very minimal symptoms, but nevertheless, you can still transmit the infection. And if you do have any of these symptoms, please do get in touch through the NCDC hotline, and we'll arrange for you to have testing. Finally, I'd like to acknowledge contributions from organizations and individuals who continue to support our national response to COVID-19. In particular, today, we'd like to appreciate the support we have received and continue to receive from financial institutions, including Wema Bank, Unity Bank, Heritage Bank, Citibank, Providence Bank, and the Central Bank of Nigeria. Thank you.
Thank you very much.
Thank you very much. Good evening, everybody. A quick update on the situation with regards to the evacuation of Nigerians. As the chairman has said, we have evacuated Nigerians from Dubai, London, and the U.S., Newark. And well, first of all, I would like to express our profound gratitude to the heads of our missions in the United Arab Emirates, in London, and in New York. They all worked extremely hard in the consulates and the embassies, and were able to deliver very good results. So I really thank them for their very, very hard work. The flight from the UK, unfortunately, was a unique flight, as I mentioned. It's the only one we're going to attempt what we attempted in that case, which was to drop the passengers in Lagos and then transfer them with a completely different carrier to Abuja. Unfortunately, a number of things went not the way we wanted them to go, and for that we apologize most profusely to all the passengers, those who had to wait a significant amount of time in Lagos before boarding the connecting flight to Abuja. It was totally unforeseen, something would have been difficult to address beforehand. The crew of the connecting carrier were not able to, although the plane was there, unfortunately were not able, for a number of reasons, to board the plane immediately and take the passengers to Abuja. We were fully engaged during the whole process, trying to get that plane to take off quickly. But as I said, unfortunately, this did not happen, and we apologize truly to all those passengers. And also in Abuja, there were some logistic issues that again created some delay, and there again, profound apologies. We have put in place mechanisms now to ensure that no such thing occurs again, and have really taken all the strictest measures that we need to take. And we saw the benefits of those, and those new mechanisms we've put in place, because the flight that came in yesterday from the United States, everything went seamlessly, and that's how we would want to keep that going forward. Now we have over 600 evacuees in various accommodation in Lagos and in Abuja. And we're reaching, as I understand from our medical people, a saturation point, the maximum we can really cope with and be able to deliver adequately and professionally the services and the care that we're supposed to. So this will mean that we will be staggering our flights in evacuating Nigerians, and making sure that we deal with the ones that we have in place before bringing back others. But we certainly, will hope that in an adequate period of time, we will be able to bring back some of the others out there. And there are many still out there, Nigerians in China, in India, Canada, South Africa, Sudan, France, Lebanon, Egypt, and all this really calls into question our absorptive capacity, our capacity to absorb, such large numbers. And clearly, our system is being strained, so we really have to take it easier, and also to ensure that we can deliver optimally as we're supposed to. Another issue that's come up in the media quite often has been the issue of using Nigerian carriers. I've explained in the past, and I'll do that just very quickly again. The carrier that came from the United Arab Emirates, it was not a government organized one, and the one from the UK was one that was coming already, and the one that came from the US was one that had been arranged and pretty much a private sector initiative. But the government is mindful of the importance and the need to use local carriers, and I'm happy to say that the pipeline flights, the flights that we have in process of arranging, missions are arranging, are all Nigerian carriers. So henceforth, going forward, we hope that we'll be using only Nigerian carriers. So thank you very much for your attention.
Thank you.
The Chairman, National Coordinator, members of the task force, my colleagues. My name is Amaka Ude. I report for Arise News. And my first question goes to the Minister of Health. So this morning, we woke up to the news that Nigeria is part of the countries that has ordered the COVID organics from Madagascar. So we need a confirmation from the PTF if this is true. And if it is true, we want to know who ordered it, and is it going to go through the same test process as our own local cure for COVID-19 before it's administered to Nigerians? And my second and final question to the DG of the NCDC. Well, over the weekend, I'm sure you saw the controversies that stirred up as it concerns the duration that people have to wait between when their test samples are collected and when they get their results. So we need you to really explain to us in two different ways. I know that there are some states in the country who still don't have a test lab within them. So how long does it take from when a person, let's say in Plateau, gets his samples collected and taken to Abuja? How long do they have to wait before they get a result? And for a person in a state that has a lab, like Abuja, Lagos, and the rest of them, how long do they have to wait until they get their test result from you? Thank you.
Good afternoon, good evening, members of the PTF. My name is Juliana Taiwo Baloyen, I write for the Sun newspapers. SGF, I will start with you. You just spoke about scarcity of bed space in states and all that. But I want to find out, because the governors are saying they don't have enough space. You've directed them to meet the Catholic bishops and all that. But then they are demanding, is the PTF going to help them in form of cash and all that? So I don't know. Maybe you might want to answer that. Then DG NCDC, sir. Someone wants to know if the claim by the so-called Life Bank to work with Nigerian Institute of Medical Research to make COVID-19 testing easier for Nigerians is genuine. He said because he finds their demand on clients' mode of transportation very disturbing. We want to get your reaction. Minister of Education, sir, want to get an update on the scholars in Russia. We want to know, he promised to intervene, and one of them said they are yet to hear from you. Thank you, sir.
Good evening, all. My name is Nike Adebowale. I report for Premium Times. My question is for the NCDC DG, sir. Sir, is there any specific reason why the recovery rate of COVID-19 patients in Abuja is low compared to that of Lagos? Although I'm not oblivious of the fact that Lagos has more cases than any other state in Nigeria. Then my second question for the Minister of Health is just a follow-up to the question I asked last week pertaining some health workers that are yet to be paid and Alex Ekweme University Teaching Hospital, Abakaliki. Thank you.
Good evening, all. My name is Friday Okerebe. I'm a reporter with Channels TV. I would like to direct my first question to the PTF chairman. You rightly condemn the threat to lives of frontline health workers, and it's really quite shocking that people will be threatening their lives. But I'd like to know, apart from condemning it, what specific action is the PTF going to take to ensure that the life of these frontline health workers is actually safe? Are you going to take any punitive measure to prevent reoccurrence of such? The second question has to do with the question we raised last week about the national response. Even though the PTF insists that there is one national response, the obvious is that many states are doing their own thing the way they want to do it. And this actually portends some dangers. I'm sure you read the news over the weekend. A lot of things happen across the states, from south-south to southwest. A lot of things happen. So my question is, what plans does the PTF actually have to engage governors in the states to ensure that they key into this national response? Because as it stands, it does appear that we have only Lagos, FCT, and perhaps a few more states that are actually keying into the national response to COVID-19. Thank you.
Good evening, all. Rachel Abuja from the News Agency of Nigeria. My first question is for the chairman, PTF. Sir, I would like to know if how much is set aside for research and cure for COVID-19 in the country. And my next question is for the Minister of Education. Sir, I don't know how your ministry is helping people with disabilities, like in the cluster, most especially the blind, deaf, and physical challenged people to learn, because you didn't mention anything for them. My next question is for the DG NCDC. Sir, we all know that we are in the era of PCR and bioinformatics. And organisms can be determined in their phylogenies, right, if I may say. within 5 to 10 hours. Why do we still have strange illnesses in the northern part of Nigeria when we can actually detect all of this? Many thanks.
Good evening, SGF, honorable ministers, and my colleagues. My name is Femi Akonde. I'm a reporter with TVC News. Sir, the SGF, I would like to ask, is the presidential task force keeping records of human rights abuses and violations going on across the country? Because it seems in this COVID era, there seems to be a rise in these cases, and maybe perhaps in the post-COVID era, some international agencies that we love to hate might come out with damning reports about Nigeria's human rights records. And then I would also want to ask the Minister of Health. There's a report that health workers are about to go on strike in the FCC as a result of non-payment of salaries and other irregularities. And we know this would be a setback to the collective fight to flatten the curve of transmission. I would like you to react to this, sir. Thank you.
Good evening, SGF, members of the PTF, my colleagues and Nigerians at home. I want to ask I am Itaire Ikwen of the NTA. I want to ask the DG of the NCDC, what's the protocol for reporting and collating confirmed cases which you announce to the world on a daily basis? We want to know, are the tests carried out by the state response teams and reported to the NCDC, or the NCDC carries out the tests, confirms and collates the cases? And for the Minister of Health, is it true that health workers across the states are refusing to attend to patients who show up with other ailments due to the shortage of PPEs and the fear that such patients might present with COVID-19 symptoms? And as a follow-up to that, I want you to also tell us, what is the PTF doing to stimulate local production of PPEs? Has the PTF identified any local manufacturer so far? Thank you.
Good evening, the SGF, honorable ministers, and my colleagues. My name is Rahila Lassa. I report for Voice of Nigeria. My first question goes to the NCDC Director General. I want to know the update from Yobe State as regards isolation, contact tracing, and treatment, because there are allegations that the index case, who was staff of the State Ministry of Health, died, and then there have been no follow-up, no contact tracing, nothing about that. The second one goes to the SGF. This is a complaint from newspaper vendors taking newspapers to as far as Maiduguri, and they have been stopped by soldiers at Kubo and Karu, and this has delayed information dissemination to the far north. I want to know what the PTF is doing to address that. Thank you.
Thank you. We have taken all the questions now. We will be receiving responses from the Honorable Minister of Health, the Director General, NCDC, the Honorable Minister of State Education, and the SGF. We'll begin with the Honorable Minister of Health.
Thank you. The first question is with regard to the cure from Madagascar. That is something that has been making the news, and we have promise of being able to get sample of the herb or the botanical product that is there for analysis, and also probably use that opportunity to speak with the health authorities there, particularly the scientific community, on how they use it. But obviously, to also give that to the research community here with us, to examine and see what they can do with it. We understand that it is something called Artemisia annua, which also grows here. But we would like to, if we get that sample, compare it with the strain here, whether they are exactly identical or whether they are two different, similar, or they are identical, and then see what properties it has. Things like that are subjected to analysis to find out what works in there, how it works, and the use in getting a cure. Obviously, all countries in the world are interested in finding a cure, and we are not different. So we look at all possibilities, all options, all mistakes that are made. We examine them, but before we give them to our people, we make sure that they're actually safe, and then we make sure that they work. Now, with regard to the health workers, well, I want to thank all the health workers who have any kind of grievance for giving notice. They should give us notice, because we must always give the government a chance to look into whatever grievance they have, so that the grievances can be addressed. Some of them are very simple to address, so if you give us notice or write to tell us of your grievance, those can be attended to. You are correct that this is not the time to go on strike, because this is when all hands need to be on deck. And we expect that the health workers will also allow sufficient time for resolution of whatever grievances they have. I'm sure some will not be very difficult to resolve before they take any action. Local production of PPE, yes, I have said before that we are in conversation with manufacturers of PPE, Nigerian manufacturers. Some have made presentations to us. They have shown us samples of what they can make, and the samples we have sent to the users. We have sent samples to NCDC to look at it to see if the way it's constructed is correct and if the material they use is good. And once we have the go-ahead, we definitely will prefer local manufacturers to foreign manufacturers. First, because they are fast and quick, they are on the spot. Secondly, because they create jobs and stimulate the economy. Yes, so we do give preference to local manufacturers. I think that's all that concerns the health sector.
Well, thank you. There were a few questions. How long does it take to get the results? So, like I said, it takes 24 hours from the time a sample gets to the lab. But there are many factors from where the sample is collected to when you get your result. There's the issue of collection. Then you have to send it. We get many samples to the lab where the form doesn't come with the sample. And then we have to go back and ask them, listen, we can't test this sample for you if you haven't sent it with the right form. So those samples cannot be tested because we can't then link it to a patient. So we go back to the state and say, listen, give us the form. So that sometimes causes a delay. Then when it gets to the lab, that process in itself takes plus minus 24 hours. Then we send the results back to the state epidemiologist. So no lab sends results directly back to patients. We send it to the state epidemiologist in the relevant state. It is now for that state epidemiologist to call each of the patients and then send the results for each individual as they would have received. So that's the process. So the time it takes really depends on the efficiency of all these various aspects of the chain that is required to come together. So, you know, this is one of, I know right now there have been many stages of complaints. Early there was the call center that has died down because we have improved it. So there have been various complaints about efficiency of processes, and every day we keep working hard to improve the process. But as we have increased the number of labs, initially we were working with a handful. Now there are 23 labs in our network, and every day we're pushing to add more. There will be these teaching challenges, and of course, there are more people to test, so there are more people that we have to get results back to. So, but one key thing that we're learning out of this is that we have to develop a laboratory information management system that works now and works into the future. So right now we're trying to make the best of what we have through manual processes. This is not how we can build a system. So we're working to integrate this into SORMAS and make sure that we can get the whole country connected into one system. So we don't actually need to send results from one point to the other. We put the results into a system, someone logs into the same system in Kebbi and pulls out the results. So as we are responding to the outbreak, these are things happening in the background to improve the system. The question on LifeBank and NIMA, I'm not privy to the details of this relationship, but I understand that LifeBank is providing sample collection booths that can support the testing in NIMA. That's my understanding of the relationship, and if that is a relationship, it's a mutually beneficial one, and I'm sure one that is helping speed up the testing rates. The question around recovery time, to be honest, I would really be cautious about over-interpreting all these numbers at this stage, right? There are many factors that influence these things, and at this stage in the outbreak, what looks good now might not look good in a month's time or 2 months' time. So let's wait before we jump into conclusions about who is discharging more and who is discharging better. There are many factors that lead to that we cannot over-interpret with small numbers. There was a question about the national response. I think that was Friday. I think, there is one national response. It's easy to say national response, but if you now break it down into components of that response, is there one national response around laboratory diagnosis? Absolutely. Everything is coordinated nationally. Is there one national response around surveillance? Absolutely. We're using one surveillance database across the entire country. Are all EOCs working to similar guidelines? Absolutely. So if you now look down into the components of each part of that response, you will see how we have one national response. Of course, every state in Nigeria can still do a few things differently, but across the major parts of the response, there's one approach. Just like we've issued guidelines today on integrating private sector labs, that is exactly what will guide the integration of private sector labs across the entire country. The question on strange illnesses. This is really a question for all of us as we improve our diagnostic capacities in the country. I think Nigeria will never be the same after this outbreak in terms of lab diagnosis. And this is one big thing that I think will change, that we will now have a network of labs across the country that is able to make this diagnosis as we find new cases. A lot of these cases are not necessarily strange. They're strange because we don't know, and we haven't made the appropriate diagnosis. So yes, right now we're all overwhelmed by one particular disease, but one thing is for sure, is how do we integrate our lab networks into a platform approach so that we end this practice of having HIV labs, TB labs, influenza labs, measles labs, and rather have molecular labs in specific locations across the country that can provide the diagnostics for all of these infectious diseases. That is the vision of everything we're doing now, and that is the output I hope we can achieve after this outbreak. And finally, the protocol for collating results. Right now, all the results are part of our laboratory network, so they would report those results to us. But before we share those results with the public, we go through a verification process every evening, which is why sometimes it takes a while for the results to come out. We generally have all the results by 6, 7 p.m. But we then call every state in Nigeria to make sure that they are aware of the results, because we don't want a state to be surprised. NCC has announced 20 cases, and I haven't heard about it. There are a lot of sensitivities around this. So we call every state epidemiologist. Sometimes we can't reach him, we keep trying. Sometimes we can't resolve sometimes we don't actually announce the result for a state because we have failed to reach someone senior enough to accept and acknowledge those numbers. So it's a very careful balance around trying to be timely and at the same time respecting our colleagues at the state level so that they are not surprised by the number of cases we're reporting. Especially now that everybody is so sensitive about the results. You can see in a couple of minutes after we announce the results, you can see the number of shares and views that those results have. And finally, on Yobe, I'm going to get an update myself. I'm not clear on the details, so we'll look at the question on Yobe. I'll probably answer it in detail tomorrow. So thank you very much.
Well, good evening, everybody. I think the question had something to do with how we engineer learning for special students. Right now, there are no special provisions for them. As a matter of speaking, almost all special students in the different categories would have to use the guidance we had given normally how they learn when they weren't before COVID. For blind students, the Braille centers that we established had already materials that they could take home and study with. Because the way we teach special teachers, because our special school in Oyo, where we prepare special teachers for special students, we prepare them to be able to give them materials that they can study on their own ahead of curriculum before coming to school. But for the deaf and dumb, because they have special schools for them, because of their own peculiar learning disabilities, we cannot transmit online without necessarily leaving them with the material. So when there are people who are able to communicate in the manner we have behind me, they also demonstrate that over a TV program or a broadcast so that they are able to absorb that. We're also communicating curriculum along with it when we broadcast. However, where those are not available, they may need special interpreters who can then communicate that at the level where they may be at the various places where they have gone back to, because we can't assemble them at a particular place to them. So the visually impaired or the hearing impaired, both are special in the way information gets to them. Every other person who has any form of other physical limitation but can hear and can see will have to use the same online services that we've made available to the generality of our students. That's it. Huh? Oh, okay. Good news for all our scholarships. Yes, the money has actually gotten to the embassies. We don't pay students directly. The embassies at the various locations. We've just confirmed this afternoon that UK has really gotten their students have confirmed that scholarship has been paid in the UK. I don't know why Russia hasn't begun disbursing, but maybe they've started because the calls we only got from the schools proper. We've not gotten from the students. So the same batch, UK and Russia, were done the same time last week. And so if today is just Monday from the last month, we only opened this working last Monday. So I'm sure the CBN finished processing all of them. And by this morning, we have confirmed from the UK that students there have already started receiving credits to their schools and then credit to them. So I'm sure that maybe by the end of work today or tomorrow, students can then in Russia as well get the same kind of news because the batch was the same. The CBN did them at the same time, so I'm sure that all of that is done. Thank you.
The SGF to take the podium.
Well, thank you, but I think most of the questions have been answered. Let me just provide further information with regards to the Madagascar the syrup. It's been freighted to Guinea-Bissau by the president of Madagascar, president or prime minister, sent it to Guinea-Bissau. And certain allocations have been made to different countries. We have an indication of the quantity that has been allocated to Nigeria, and we are supposed to make arrangements to freight it out of Guinea-Bissau to Nigeria. I've received instructions from Mr. President to make arrangements to freight it home, with a clear instruction that I should subject it to the validation process, similar to what would happen to any other medicine or syrup or vaccine that is discovered or created internally. So it will be subjected to the same process before it is put into any form of use. There will be no exception for that. Dr. Chukwe has answered the question about national response. We have only one national response. What you see happening across the state are just strategies of implementation of the non-pharmaceutical initiatives or interventions. But as far as the response against COVID-19 is concerned, is one, and he has outlined the fundamentals. But Mr. President was also mindful in his speech to say that states can put in place processes that are peculiar to them, with a caveat. It must be within alignment with the framework that has been provided. So the applications in different states in terms of the non-pharmaceutical interventions differ. And that's what you saw reflected across the country over the weekend. Some are very, very determined. So they step up their actions. They go out there, ensure total compliance with the guidelines, either put by the federal government or put by the various states. Because the Quarantine Act provides for the states too to in place certain laws or declarations that will serve the purposes of that particular state within the context of the declaration made by Mr. President. So the variations you see are not out of order as such. There could be some certain excesses that are not prescribed by any law, but that's not the norm or the rule. Those ones are exceptions to the general rule. The other question that has to deal with bed space, it's a statement of fact, and it's a realistic postulation looking at what is happening. You don't have to wait until all the best beds are exhausted before you raise the stakes in terms of provision. Over a month ago, I said it here, addressing you, that we are requesting states to provide at least a 300-bed facility as an isolation, in addition to part of it being used as a management center. Because if you have an ICU, it's a management center. It's not an isolation center alone. We've continuously drummed that, because we are looking at the modeling, we are looking at the graph, we are looking at the trajectory, and looking at the figures as they rise. And when you begin to see in a particular state, the figures moving from 20, 30 a day to 80, 100 a day, you know that definitely, whatever the calculations are in terms of bed space, very soon that figure would far outstrip the bed space that is available. And that is why we are saying that take advantage of every offer that has been made. And specifically, I referred to the offer that was made by the Conference of Catholic Bishops very early into our developing our response and our management of the issues. They have, across the nation, 425 health facilities, from hospitals to clinics to dispensaries. And they have made it available. And that's why we are now requesting the state governors, we have said that before, we're just re-emphasizing it, that if you're running out of your space in your own health facilities, the Conference of Catholic Bishops have offered this. So approach the leadership of the church in different states and see what you can do with the facilities that have been offered. Because they've offered it, they're not asking for any payment for it. They're saying that, look, use it, adapt it. If you need to do any update on it or improve on it so that it meets your purposes, but we have made it available for the use of the good of the people of Nigeria. And I believe that's an offer that in every place we need to take advantage of that and ensure that we utilize it. Following to that, in my statement today, you must have heard me talking about community ownership of the process. And we were calling all our community leaders, religious leaders, to step up. The reason being that transmission is already in our communities. Because the first approach that we put in place as a presidential task force was to contain the importation of the virus. We've gone past that now. We are not contending with the importation of the virus. We are contending with the transmission that is taking place in the communities. So the availability of bed space everywhere must be taken into cognizance in this next stage of approach. And I did say in my statement that we are working on a protocol that will soon be released as to how we can take advantage of all the facilities that we have all over the states, all over the local governments, and all over the nation, to prepare them and put them in the state in which they can deal with the issues of community transmission. Because it will soon become impossible for the state capitals to begin to contend with the numbers that might be thrown at them. And if you can localize a cluster in a particular local government, you need to begin to prepare for the containment or for the provision of infrastructure in those local governments. So we will need more bed space. As more bed space are made available and are being prepared for that particular exercise, every bed space that is being offered should be taken up by the state governments. Ours at the national is just to give the framework of the direction of where we should be headed. And I expect the states to key into that. Human rights abuses. Yes, even yesterday I got a letter from the Executive Secretary of the Human Rights Commission cataloging what has happened since the ease on the lockdown. And each component is broken, and a similar letter goes to the head of the institution that is being accused of the infringement of human rights, because we have tried as much as possible to deal with that and segregate whatever accusations there are and send to the various heads so that appropriate investigation and disciplinary action can be taken. And also proper investigations can be conducted to ascertain the veracity or the authenticity of the allegation. It is not just to be taken on the face value for most of the accusations that are being made. So we have developed a process. And whenever those organizations, like the police, the DSS, after they have investigated, we get a report. And the intendment of that is for us to compile and keep for record purposes. These are the number of infractions, these are the actions taken, and these are the remedies that have been put in place. Like you rightly said, after COVID-19, somebody can just raise an issue about human rights abuses. But if you have codified, documented what steps have been taken to redress those human rights abuses, that will be a proper defense for the actions that have been taken by the different security agencies and organizations. Newspaper vendors. Well, we consider that to be essential services, but I don't know what a vendor is doing in Abuja. Why should he be heading to, is it Borno you said? Yeah? Okay. But does the vendor in Abuja go, does he have to go to Borno? I thought they just dispatch these things. You know? Oh, vehicle, not vendors, not the newspaper vendors. If you say vehicle, media houses, vehicles, I know that they are the ones that normally move the papers or they are air freighted. I know that sometimes newspapers are air freighted because I used to live in Yola. We will always receive our paper one day behind schedule because we have to wait for the plane to bring it and before the vendors will share it. So I assume that that is what is happening. As much as possible, media and news items being circulated and distributed across the country fall under our exemption of essential services. Because if the papers don't get to the communities, they will be fed with wrong information through social media, through all manners of things. So I believe that the police too, and the agents are watching this live briefing. They will take appropriate measures to ensure that vendors are allowed free access, newspapers being sent to different locations in the country should be allowed free access. And lastly, the issue of assault on health workers, whether there is any punitive measures we can take. Well, that's a very difficult question because we are dealing with people infected with a virus that is a matter of major concern to public health. It's not as if having threatened health workers, harassed health workers, held them in captivity. At the end of the day, you'll be wondering, what do I do with this patient? Do I send him to jail to go and infect more people in the jail? Or do I keep him in the isolation center and try to nurse him back to health? I think it's all born out of anxiety, sometimes to the point of frustration, because most of the young persons that are infected by the coronavirus, you saw them like the ones in Gombe. They are young, they are active, they have a lot of energy because they have not come down with any symptoms that incapacitate them. I believe a lot of counseling needs to go into some of these situations. What do I mean by counseling? Probably in the development of the protocol of managing these isolation centers, a lot of talking needs to be done. And I believe that the Center for Disease Control and the Ministry of Health are doing their best in terms of deploying the kind of people that should manage these patients. When you have about 100 people who are infected and are kept in one location, and they are told that they are carriers of this virus, but they feel very strong and they don't feel sick or down with any form of ailment. The chances are that they will begin to get a little bit anxious and that their actions can step out of bounds. For now, I don't think we would pursue any punitive measure. The most important thing that we have to do with them is to make sure that our health workers are secured, they are protected, and these patients or those that have tested positive to the coronavirus receive some bit of counseling and some bit of engagement so that they don't feel upbeat and anxious and frustrated and begin to let it out on people who are supposed to help them transit from being positive to negative. So I would only continue to appeal to the people that have found themselves in the isolation center to say our hearts goes out to them. We wish them well, and as a presidential task force, we will do everything humanly possible to ensure that they are managed in a manner that they will move from being positive to negative so that they can get out of the isolation center. But in the same vein, they should appreciate the services of the frontline health workers. They don't mean evil. They don't mean to do them any harm. They are there to provide services to them. And they should also understand that in the process of doing that, they don't have to endanger them and endanger their lives. So I think basically these are the questions that I have, and I think I've made a fair attempt to answer those questions. And to say, we and you have a responsibility to ensure that this fight is taken to the last bit. This fight is done in such a manner that we do not in any way create an opening that will cause our nation to suffer much affliction as a result of the scourging nature of this pandemic. I believe that the figures, like I said in my statement, are quite, can create some bit of anxiety, seeing the figures as they are growing. But we have an explanation for it. And that's the explanation that I want Nigerians to understand. That we had reached a stage of community transmission. And we are ramping up the tests. When this whole exercise started, I think Chukwe started with only 2 labs. Today we have 21, 22 in operation, 23 in operation, and we are pushing. So as you are testing more, the evidence of what we've been talking about will begin to show in the different localities. All we need to do as quickly as possible as we establish those clusters and those individuals within the community, they are taken out so that they do not continue to transmit. What that basically means is that we want to interrupt the spread of community transmission so that we can reduce the number of people that would get infected. But for us to stand and tell you that the figures will not be there would be a bunch of lies, because we know that community transmission is ongoing in our communities. How we respond will depend on what we individually do. Like I said, we must take responsibility. We must ensure that we observe the basic advisories that have been issued by the professionals. That way, we keep safe, we keep other people safe. Thank you. What is it? I thought Dr. Sani would know that, because He's the national coordinator. He's in charge of the budgeting. But I think some amounts of money have been set for research. Not only that, on an annual basis, most of our ministries commit some funds for research. And I believe that the Health Ministry, the Ministry of Science and Technology, and all those ministries that are charged with research efforts. But I think even as a presidential task force, Dr. Sani, probably you take that question, as a presidential task force, certain amount of monies have been set aside for the purposes of research. But on a long-term basis, like I said, Ministry of Health with its agencies, that's NIPRI, NAVDAC, and the Nigerian Medical Research Institute, all of them are committed for research. So every money that is sent on their budget line, specifically some portion of it goes to research every year. So the question of research is just not for now. It's a continuous process. And I believe that they are doing that. If you saw some of the inventions that came out of the Ministry of Science and Technology from some of their agencies, the tunnel for disinfection that I saw them create, all that came as a result of research. Some equipment that they manufactured for the purposes of street disinfection and the rest of it, all these things came out of research. They have even developed ventilators. The DICON in Kaduna, the defense industry in Kaduna, out of research work, not thinking about even COVID-19. They have developed a ventilator. I had a demonstration in my office, and I think the Minister of Health too had a demonstration in his office. Some of them have even developed the PPEs that we are talking about. And we are looking at the local content element of that to ensure that we encourage our home-driven industries to produce most of these things, not dependent on export or import. Because every country is contending with this, and that accounts for the scarcity. And I believe that all these research institutions are busy looking at the prospects of other research work that will help us in dealing with this particular pandemic. Thank you.
Thank you very much. That brings us to the end of today's national briefing. We must remind you, as always, that first, please wear a mask always, or a covering, whenever you are out in the public space. We must also stand up for our healthcare workers. Our frontline health workers put their lives on the line for our sake. They provide care and nurse our patients back to health in this perilous time. They are our heroes. Please do not be hostile to them. Do not attack them. Do not hold them hostage. Please show them respect, whatever your COVID-19 condition is. We assure our heroes of their protection and security at all times. I thank you very much. God bless Nigeria. We hope to see you tomorrow. But do not forget, this day dome will be commissioned tomorrow at 10. Thank you very much.